Philosophy doctoral research proposal. Patients transfer queuing, insufficient physicians, a healthcare problem in lagging countries. Case of Rwanda. By Mr. Eric Mupenzi. Research background. As the population of underdeveloping countries continue to grow rapidly, their healthcare systems face many challenges, among which patients transfer queuing due to the insufficient physicians being the most concerning one. According to the data published annually by World Bank 2018, the population growth of underdeveloped countries is 3 times that of the developed countries. This, together with insufficient resources and budget dependency, worsen further these countries' healthcare systems by reducing physician-patient ratio per 1,000 people, WHO, 2018. Nevertheless, lagging countries still invest less in healthcare sector/service, assign lower GDP portion, in comparison to the developed countries' counterpart. While third world and modern countries may have different political will and commitment towards the enhancement of their healthcare systems, they all agree on one fact, namely, a good healthcare service can lead to a prosperous, stable economy and strong, healthy population, which in turn produces a stable political system. Moreover, countries with a stable political system has the ability to provide other essential needs to their inhabitants/people. On the contrary, countries with a poor healthcare system has a weak economy and in most cases an unstable political system. This may lead to an unending fighting war, which prevents the country's population from reaching the already insufficient healthcare service and other citizens' needs. Olatunji, 2014. Therefore, how to improve the healthcare system is nowadays a highly debated subject worldwide. Good example in the developed country is the USA, where in 2010, the 44th President Barack Obama announced its country healthcare system reform to provide low-cost, affordable, and yet high-quality healthcare services to all American citizens. This healthcare reform policy will especially improve the lives of those with low financial incomes. To accomplish her goal, the U.S. government spend $2 billion annually on healthcare system for offering most competitive medical technology and scientific research worldwide. Laxmaya Manchikanti, 2017. Furthermore, developing countries too have followed the same path. The representative one is Rwanda, a small country situated in East Africa region. This country had established a strong, stable health insurance scheme, as well as a reliable policy for delivering it since the year of 2004. This healthcare insurance, commonly known as mutual health insurance, Saxena, 2010, has tremendously improved this country people's lives, as witnessed by an ever-growing number of people going to the hospital for diabetes treatment and other everyday healthcare services. Although the cost of the healthcare service has become affordable, the shortage in the number of physicians per population is another problem, which require queuing of patients transfer. According to Daniel B. McLaughlin, 2008, the latter may delay or even limit the accessibility of already put in place healthcare insurance. To shorten the time that patients spend at hospitals waiting for healthcare services or transfers to more advanced hospitals, hospitals managers need to come up with a more reliable scientific method, which may help them in their decision-making and policy reforms. The appropriate scientific modeling technique helps hospital managers not only to locate the appropriate site for new facilities and possible future patients' need, but also the accurate information and appropriate medical device systems to deliver patients with high-quality healthcare services. Denton, 2013. Besides, these more advanced scientific modeling methods aid in sharing the patient's information among hospital staffs, thereby reducing patients' waiting time. The reduction in time spent on waiting a healthcare service at any hospital increase patients' trust and satisfaction. Dansky, 1997. Nevertheless, shortening waiting times that patients spent on healthcare service provider is still a difficult task, especially in developing countries. To improve the quality of healthcare service, various authors have proposed different simulation models, i.e., queuing theory and other optimization models. However, there is still a gap between healthcare delivery and patient satisfaction. Frederick S. Hillier, 2013. This work aims at applying queuing theory in healthcare systems to reduce the time that patients spend at lower healthcare facilities waiting for their transfers to higher facilities. The proposed model can also facilitate medical doctors in scheduling patients' rendezvous. The presented technique is based on queuing theory, which was proposed for the first time by Danish telephone engineer Agner Krarp Erlang in the beginning of the 19th century for studying automatic telephone exchanges. Other scientists, namely Millens, Thomton D. Fry in 1927 and David George Kendall in 1951, contribute immensely to the improvement of the latter, making it possible to be applied to a wide variety of applications, including industry control, social behaviors, communication, and traffic congestion control. Queuing theory and simulation can also be an effective solution for decreasing the time patients spent waiting for healthcare service or transfer to other hospitals with more advanced medical equipment and experts, specialists, in undeveloped countries without increasing the number of doctors/specialists. 2, and Timerzeta, 2014. Research purpose. Many published papers in health system that used queuing and simulation modeling to overcome patients' waiting line problems have never considered economy capacity in their arguments. Consequently, most of them recommend capacity increase and system improvement as viable means to reduce the patient's waiting line suffering. However, the hospital's capacity may also depend on its size, as well as its infrastructures. In fact, financial means and technological advancement are the main constraints that define countries' economy and society's well-being. Luke, 1999. Unfortunately, for undeveloped countries, the limited income and dependent budget make it impossible for capacity increase. As a result, a reliable method that can reduce the time delay of patients being transferred from lower to higher hospitals, with more advanced medical facilities and experienced specialists, is of greatest interest. In addition, an accurate and systematic method may also aid physicians, medical doctors, in scheduling patients' operation and treatments, thereby improving healthcare service, gaining patients' trust and satisfaction. 0s. This research aims at accomplishing the following objectives. Investigate and explore the challenges of applying queuing model in health systems of underdeveloped countries while taking into account capacity is alternative. Assess and analyze the resources utilization in public hospitals using the queuing network models. Demonstrate how one emergency case interrupts the other due to priority discipline. Significance of the study. Africa is a continent considered as the rest of the world in the context of development. Africans should learn from developed countries with a long development history. The latter can be traced back to the Industrial Revolution in 18th century. The continent has several problems, including industrial and healthcare service, which need to be overcome. For instance, Rwanda and East African community countries in general still struggles with high infant mortality rate, inability of treatment of non-communicable diseases, such as cancer, heart attacks, diabetes, brain diseases, lung diseases, etc. In these countries, industries also experience management crisis because of poor management and resources misallocation, which in most of the time require hiring experts from abroad. All of these issues are caused by the lack of experts in management science with advanced modeling skills, high qualification, as well as lack of training from experienced experts, professors. By thoroughly exploring the proposed queuing modeling technique, it is expected that the healthcare